Hey everyone, it's Dr. Haram here and today I'll teach you about carpal tunnel syndrome. Let's commence the video. So the word carpal is derived from the Greek word carpus, which means wrist. It is caused by compression of median nerve. Let's have a look at the anatomy of the carpal tunnel. It consists of transverse ligament, carpal bones, as well as the flexor tendons that pass through the carpal tunnel. The median nerve passes through the tunnel and the inflammation of either the tendons or the transverse ligament can cause the compression of the median nerve. The symptoms involve pain, numbness, weakness in the wrist, fingers, hands. The patient will have weak grip strength. There will be muscle atrophy of the thenar muscles, and in advanced cases, the person will have the electric shock like sensation in that area, as well as the patient will have difficulty performing the fine motor skills. The patient will find difficulty in buttoning, zipping, and typing. Highlighted ones are the areas which are supplied by the median nerve, so the sensory loss will occur in the thumb, index finger, middle finger, and half of the ring finger. Risk factors include the occupation that involves highly repetitive hand movements or wrist movements, the use of the vibrating tools, the computer use, especially typing, or the use of the mouse. These repetitive movements cause the inflammation of the ligament or the tendons, which cause the compression of median nerve. Other risk factors include age over 50, sex. Women are more likely to get carpal tunnel syndrome due to hormonal changes. Obesity, which is linked with high amount of fat in body as well as increased inflammation. Some medical conditions including diabetes, thyroid problem, either hypothyroidism or hyperthyroidism, or liver condition, hormonal changes, wrist anatomy, poor ergonomics while using the mouse or typing, family history, previous injuries, or pregnancy, because pregnancy is linked with high rate of fluid retention in body. Here are some of the special tests for diagnosing carpal tunnel syndrome. The first test is compression test or the Durkin's test, in which the examiner uses the thumb to apply the pressure on the median nerve of the patient and the pressure is maintained for 30 to 60 seconds. The test is positive if the patient reports pain or numbness. The next test is a Phalanx test, in which the patient is asked to maximally flex the wrist and hold this position for 30 to 60 seconds. If the patient reports pain, numbness, or tingling, it means the test is positive. Phalanx test is the most sensitive test for carpal tunnel syndrome diagnosis, with sensitivity of 80 to 90%. Next is reverse phalanx. The patient is asked to hold this position for 30 to 60 seconds. If the patient reports pain, numbness, or tingling, it means the test is positive. Another test for diagnosing is tunnel sign, in which the therapist uses the index finger to tap on the median nerve for 30 to 60 seconds. If the symptoms appear, it means the test is positive. And another one is square wrist sign, in which the wrist thickness to wrist width ratio is greater than 0.07. These patients are likely to have carpal tunnel syndrome with this ratio. Other diagnosing methods include electromyography and nerve conduction test. Moving on towards the treatment part, so conservative methods for treating carpal tunnel syndrome involve rest and ice, physical therapy, splinting, pain relief medications like NSAIDs, and corticosteroid injections. Now moving on towards the physiotherapy treatment. The patient is recommended to wear the wrist splint to hold the wrist in neutral position, so avoiding the repetitive movements and reducing inflammation. So the patient can be asked to wear the wrist splint at night or during the day for more severe case, and may be asked for wearing it for 2 to 4 weeks. Another method for treating carpal tunnel syndrome is nerve gliding or tendon gliding exercise, and evidence is highly suggestive of their effectiveness. This is the neural gliding exercise for median nerve, and the patient can progress according to his capacity. This is our tendon gliding exercise for treating carpal tunnel. Exercise therapy plays a fundamental role in treating carpal tunnel syndrome. Stretching exercises include wrist extension, wrist flexion, finger spreads, finger bends. Another treatment method is strengthening exercises. Other methods of treatment include heat and cold therapy, ultrasound therapy, TENS, laser therapy, acupuncture, ergonomic modification. Still, there is lack of evidence on effectiveness of electrotherapy. Thanks for watching the video. Please do support us. Please like, share, subscribe, and don't forget to hit the bell icon. I'll see you guys next video. Bye.